In this meeting, every year we bring together policymakers, doctors, insurance companies, and members of the industry to share their views of some of the main topics in healthcare. The main discussion was around how to create value in this change of the environment that the healthcare sector is facing. And we reached 5 main conclusions: providing more data, more transparency, and getting to know what works and why, so that we can compare our performance with the performance of other colleagues, of other insurance companies, other hospitals, etc. To engage the patient, to get the patient more involved in healthcare, making him part of the process. If we want to foster value, to be more efficient, first we need to invest and to innovate in the right ways. The best way to innovate would be to generate new partnerships by providing different types of contracts with the partners, in particular with the public sector. We have to do more public-private partnerships, but we have to do things differently in this environment. We have to find ways in which we can share our risks and in which the incentives to innovate and to keep creating value can still be there.
I think the question of whether or not innovation in the United States can be sustained is an important one. If you look at the United States healthcare system from the outside, I think it's fair to say that we're the best at 2 things. We're the best at spending money. We're also the best at innovation. But now the focus is going to change. The focus is going to be much more on saying, how can we innovate to try to drive value? How can we produce a more meaningful improvement in quality and to do so at a lesser cost? We could communicate perhaps via a secure portal, via an email type portal, where they would have access to the results. Or maybe we would do it virtually via an interface like Skype. Or maybe that they would meet with a member of my care team instead of meeting with the doctor directly because I'm the most expensive resource. Those types of innovation in care delivery are also going to be a lot of what you see coming out of the United States in the next several years.
More than 85% people, they are using internet very quickly and oftenly. So they get all the information, including the medical information, the health information from the internet. And also they even using internet to help them to find hospital, doctor, medicine, and some other health information. To them it's very usual. And also based on that, now there are more and more so-called remote treatment program is developed. And also there are more and more entrepreneurship projects, which is basically innovated by the young people. They're doing that. So yeah, this is like a new stuff and a young stuff.